staying up with us. I'm Mallory SOFASTAII. Almost 3 million people worldwide have died from COVID-19, and we are still learning about the toll the infection is taking on survivors. Kent Taylor, founder of the popular restaurant chain Texas Roadhouse, committed suicide Thursday after a battle with severe post-COVID-19 symptoms. Johns Hopkins doctors say he's not alone in the long struggle physically and mentally. WMAR 2 News' Abby Isaacs tells us one Maryland man's heartbreaking story of his nearly year-long battle post-COVID.
Even though he's an essential worker, he hasn't been back to work since last April when he first got COVID-19. The physical and now mental impacts of long COVID taking their toll for the last 11 months.
The breathing just was just so bad.
It's unlike anything Calvin Mahoney has ever experienced.
It's like having just breathing through a straw all day.
The 32-year-old father of two from Gaithersburg has been battling post-COVID-19 symptoms since last April, unable to get a diagnosis for what's causing his pain. His scans, his tests all come back normal, even though he feels far from it.
It's been a year and just the miserable.
An estimated 10% to 30% of people who survive COVID end up with enduring symptoms, ranging from fatigue and brain fog to sleep disorders, fever, breathing issues, and depression.
The mental is actually a little worse than the physical. Just not being able to provide how I used to, not being able to do what I'm supposed to do with my kids. My kids. Yeah, it's been tough.
And in his darkest moments, it feels like all hope is lost.
2 days ago, I was telling my wife I don't want to wake up.
But he fights on for his family with the hope that maybe one day soon he can go back to work, that maybe one day there will be treatment. One source of strength is Dr. Panagis Galiatsatos and the Johns Hopkins post-COVID-19 clinic.
And even if we don't have the answers, we have to advocate for our patients.
They work with so-called long haulers, addressing all aspects of care.
Severe depression, severe anxiety, severe social isolation, physically, where they feel like a lot of them feel like they have to learn how to walk again.
Dr. G says their most common referrals are for mental health professionals. And after seeing all the attention given to developing vaccines, he wants to see an equal amount given to addressing post-COVID-19 and mental health.
We need mental health resources now more than ever. So yes, if you want to fulfill medicine as a public trust for all, we need to do it now more than ever in the pandemic and put resources for patients like Mr. Calvin.
Dr. G says the clinic is full with patients for at least the next month, and they're looking for more resources so they can help more people. For WMAR 2 News, I'm Abby Isaacs.